Hello everyone, I am Dr. Vivek Venkat, consultant Uro-Oncologist and Robotic Surgeon in Mumbai. A lot of my patients ask me whether it's normal and they can live a normal life if they have just one kidney. As we all know, the kidneys have very important functions in the body. Their main job is to detoxify all the harmful substances in the blood and filter them out through the urine. They are also important in maintaining the acidity and base balance of the blood, as well as they produce certain hormones which are important in performing various functions throughout the body. So it's natural to wonder whether the absence of one kidney could affect these functions to such an extent that it would impact the person's life. So there are a number of causes of patients having a single kidney. There is something known as unilateral renal agenesis, which is a congenital condition in which one kidney is absent. This is seen in almost 1 in 1,000 to 2,000 people. So they are just born with a single kidney and they would never come to know about it until they maybe do a scan when they are 50 or 60 for some completely unrelated purpose. So it's absolutely normal for one kidney to maintain an adequate function throughout a person's life. This also happens because the opposite kidney compensates with growth, which is known as hypertrophy, and takes over the function of the absent or missing kidney. Another common reason for patients to be with one kidney is a kidney donation. So when a patient donates a kidney to a recipient, both the patients have a single kidney, that is the donor as well as the recipient. And after the transplant, we expect that both of them would live completely normal lives in terms of their longevity. Of course, the recipient has certain restrictions and needs to take lifelong medication to prevent rejection of that kidney, and that requires exceptional and special monitoring by the nephrologist. But the donor is absolutely like a normal person. Another common reason for a patient to live with a single kidney is when the diseased kidney is removed as a nephrectomy. This is seen if the kidney was non-functioning due to certain causes like stone disease or strictures, or if it had a large renal tumor which necessitated its complete removal. Once again, in this case, the remaining kidney takes over the function and most patients are able to live a completely normal life. There are certain myths which patients believe when they have just one kidney. One of the common ones is that they can't play any sports because the kidney is in danger. This is not really true. What may be restricted is certain contact sports where there is a risk of injury to the kidney, and since you have only one kidney, we would like to protect it as far as possible. But other than that, there is really no restriction. Walking, running, cycling, whatever you may want to do, marathon, everything is very much possible with a single kidney. Bodybuilding, especially when large muscle mass needs to be developed, that may put a potential load on the single kidney because of the large amount of protein intake that may be needed to achieve those results, and therefore it's important to be careful that you don't take excess protein, red meat at those times in order to protect your single kidney. Another myth, as we discussed, is that those with a single kidney cannot live a normal life in terms of their longevity, and this is completely false. Of course, there is certain monitoring that's needed for patients on a single kidney, and especially in those who have high blood pressure or diabetes. Both these diseases are known to affect kidney function in the long term, and therefore those with a single kidney need to be extremely careful that their blood pressure and sugars are maintained in the normal range as far as possible. They take their medications regularly, they get good exercise in order to improve their general cardiovascular health, and that itself will translate into good outcomes for their single kidney as well. Of course, there are simple lifestyle modifications which patients with a single kidney may take. One of the most important ones is to maintain adequate hydration at all times, as dehydration is a stressful state for the kidney. Don't take too many over-the-counter analgesics or painkillers, as those too can affect the function of the kidney, and therefore it's important to ask your doctor before taking any such medications. A diet which is slightly low in salt will help to reduce blood pressure, which helps to protect the kidneys. Again, excess protein or red meat intake also should be avoided. Anything which is healthy for your heart is healthy for your kidneys. So whatever diet is recommended from the cardiology point of view would have the same beneficial effects on the kidney as well. In terms of monitoring, regular checkups of the blood pressure, a urine examination to look for any protein, the renal function tests like creatinine in the blood or urea and nitrogen will give us an idea of the kidney function, and we do recommend those on an annual basis as part of your annual checkup. I don't do transplants much anymore, but during my training and in the early periods of my practice, I was involved quite significantly in the transplant program. And as a student, I remember donors coming 20 or 30 years later along with their recipients and both doing perfectly well. And this was really, quite inspiring and quite proof of the fact that you have a good long-term outcome even with a single kidney. If you found this video educational, please like and share it with others, and don't forget to subscribe to my YouTube channel. Thank you.